Hi, I'm Danielle, the physiotherapist at Strengthen You Therapy. Today I'm here to talk about chronic low back pain, so back pain that's persistent, it's been going on for a while, and how it relates to core activation and core stability. So often when we hear core, we think about abs, six packs, and our oblique cuts. These are the global core muscles, so the rectus abdominis, external obliques, and the iliocostalis, which is a muscle in our back that links the bottom of your rib cage to the top of your pelvis, so this bone here. They're big global muscles. They help with large movements, but they don't help stabilize the spine. What people often don't consider when they're training their core or thinking about core strength are the local muscles. So the small muscles that stabilize each spinal segment. So they act almost as a muscular girdle or corset that help keep your spine in alignment and avoid excessive twisting or bending that can cause chronic low back pain. So if you think of your spine as a tent pole, the musculature around your spine that make up your core muscles act as guidelines that help pull the tent pole and make sure that it's not moving to either side. So people with chronic low back pain often hear they need to do core strengthening, and one of the biggest mistakes they make is doing a progressive overload training program. So repeated crunching exercises, bringing your back into a lot of flexion, which is the exercise that usually aggravates it as well. It also creates a muscle imbalance. You get a really strong anterior front core when the back of your core here, your spinal erectors, can't battle it. So you have a bit of a muscular imbalance. So now what I'll do is show you 4 exercises that you can do to strengthen your core, keeping a nice neutral spine without that excessive bending forward or flexion. So I'm going to go over 4 key core strengthening exercises that create core and postural endurance and use synchronized movement of many key muscle groups. The first exercise is a plank. This involves strengthening the anterior or front and posterior back parts of your core. Things to look out for in a plank are maintaining neutral spine, so not letting your hips drop too far forward or your hips be too bent, and so you're in almost an A shape. Other things to look out for are not locking out the elbows and squeezing the glutes together, as well as squeezing the legs together to create one solid line of power. The beginner version starts using a box. A progression would be doing it flat on the floor. This makes it harder for your shoulders and back postural muscles to stabilize you. Things to think about are not rounding too much through the upper parts of the back, keeping the shoulder blades pinched together and away from the ears. The second exercise is a side plank. This includes the lateral core, which is comprised of the oblique muscles, the quadratus lumborum, and the transverse abdominis. Things to look out for during this exercise are not letting the hips fall too far towards the ground or be too high up in the air. You want them level so your body is in one solid line. A progression would be lifting the opposite arm and leg into the air and stabilizing in a static position. Make sure that it's in line with your shoulder and hip joint. This activates the other side of the lateral core to keep those extremities in place. The next exercise is a bridge, which involves the anterior, posterior core, and the lumbopelvic hip region, including the glute muscles. What you want to do during this exercise is make sure your fingers can touch your heels, squeezing your glutes and tightening through the core. Lift your body up in one solid line away from the ground and hold your hips in a neutral position. Don't let your hips fall too close to the ground or be too high towards the ceiling. The progression of this exercise would be a unilateral or one-legged bridge. By not having one leg on the ground, you're forced to stabilize it using your lateral core of that side. The final exercise is the bird dog, which activates the posterior diagonal musculature sling. So that involves lifting one hand and the opposite leg off of the ground, squeezing your shoulder blade back and down, and squeezing the glutes of the lifted leg. A progression of this exercise would be lifting the same arm and same leg on one side, which activates the posterior longitudinal sling of that side and the lateral core. If you suffer from chronic low back pain or know someone who does, come in to see us to get your core strengthening and activation assessed, and we can come up with a core strengthening program geared towards you and your pain. I'm Danielle, the physiotherapist at Strengthen You Therapy. Thanks for watching.